Good morning, everyone. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Also Brooks. This morning, the County Executive, Dr. Carter, Ronnie Gill, our Director of OEM, and Dr. Askew are going to bring some critical updates to the community in terms of where we are in this pandemic and the steps that are going to be taken moving forward. So first, we'll hear from County Executive Also Brooks.
Good morning, everyone, and I thank you for being here again this morning as we make some critical updates today regarding our fight against the coronavirus. I'd like to first begin by thanking our Chief Health Officer, Dr. Carter, who is joining me this morning, as well as our Deputy Chief Administrative Officer for Health and Human Services, Dr. Askew, who is here. And we also have with us this morning our Director of our Office of Emergency Management, Ronnie Gill, and I certainly want to thank them for being here this morning, and I thank them for the tremendous job that they have done throughout this pandemic. I'd like to also thank all of the members of our health department, all of our frontline workers, essential workers who continue throughout this pandemic to work so hard to make sure that we're doing our level best to keep our community safe. I'd like to begin by saying that we are, that as we know, our federal government is likely on the cusp of approving 2 different vaccines for COVID-19, one from Pfizer and one from Moderna. We also know that they will likely be approved because the FDA has found that both vaccinations are safe and effective in preventing infection by COVID-19. This is good news, as for almost a year, our lives have been so different. We have struggled so much through this. We have experienced so much loss in our community. Many have lost their livelihood as well as have lost loved ones to COVID-19. And we know that, unfortunately, 952 Prince Georgians have lost their lives to this tragic illness. And what we believe is that these vaccines represent for us a light at the end of the tunnel for this pandemic. But what we know also is that the pandemic is not yet over. And at this very moment, COVID-19 cases continue to rise here in Prince George's County and across the country. Since March, Prince George's County has unfortunately seen 45,529 confirmed cases of COVID-19. 4,443 of our residents have had to be hospitalized. We know as well that this just continues to rise. These are, and I've said it so many times and we'll say it again today, these are not just numbers. These are people we love, our colleagues, friends, family members, neighbors. So this has been such a trying time for us, and we continue to not only work on your behalf and their behalf, but we continue also to grieve with so many who have lost loved ones and who, especially during the holiday season, are experiencing extreme distress. And so we continue to think about them and to pray for them. Unfortunately, our COVID-19 positivity rate has risen significantly over the last several weeks. We are now at 10.1%. Our infection rate is likewise very concerning at 1.10, and our average daily case rate is at 45.7 people per 100,000, above the critical level of 25 per 100,000. And Dr. Carter will discuss this more at length, but we had told you before that if we got over 25 per 100,000 cases, we would be gravely concerned, and we are now at 45.7. In addition, our available hospital capacity has fallen since the Thanksgiving holiday, with 48.7% of our beds available. And so when hospitals are busy, we know that it strains our medical system, and so we remain vigilant and remain concerned. The vaccine is not yet here, so we must act now to limit the spread of COVID-19. And we know that even as the vaccine becomes available, it will take us many, many months to make sure that we vaccinate everyone. And so we have announced in the past, prior to Thanksgiving, as you know, I announced a number of new measures to limit gatherings in our community and capacity limits for so many of our businesses. But the numbers that we are seeing tell us that we are headed in the wrong direction and that we need to take swift and quick action right now to make sure that we are working to contain this virus in our community. Today, I am announcing some additional measures that we are implementing to limit the spread of this virus in Prince George's County. Effective next Wednesday, December 16th at 5 p.m., indoor dining at restaurants must close. Outdoor dining will be allowed at 50% capacity. Restaurants can still offer takeout and curbside service, and in fact, we encourage all Prince Georgians, this is such a difficult time, to please continue to patronize our restaurants. We will work to make sure that we are supporting them. In addition, casinos will be limited to 25% capacity, and finally, all retail must reduce capacity to 25%. Again, even in the midst of this, we will continue to work to support all in our business community as we work to keep our residents safe. We will be looking at the ways that we will be able to continue to provide assistance and support to them. These new measures will remain in effect through January 16th, and we will continue to monitor our COVID-19 data and metrics in the coming days and weeks. This has been, you should know, a very difficult decision. It is not one that we make lightly, but I have done so after consulting our public health professionals, and I have promised you that at every step of the way I would receive and accept advice from medical professionals and from scientists, and that I would make the decisions that are best to make sure that we are protecting the lives and livelihood of all who live here. And given the surge in cases that we have seen and the rise in hospitalizations, we are doing what needs to be done now to save the lives of Prince Georgians. And as we work on a larger solution to reduce the spread of COVID-19 with our regional and state partners, we are also putting a heavy emphasis on compliance with our existing safety measures. And in fact, we have increased the number of compliance ambassadors that we have, and I want to compliment that we have an amazing ambassador program to ensure that all of our businesses and others in our community are following the guidance that we've been given. So we can now quickly follow up on reports of non-compliance with COVID-19 safety measures. But I'm here today also to ask for help from every Prince Georgian. We ask you please to limit your non-essential trips, avoid gathering with friends and family outside your immediate household, and if you do need to go out in public, please practice physical distancing, wear a mask, and be sure to wash your hands frequently. Now, I say it every time I stand at the microphone, but I have to say it again today. If you wear a mask that is below your nose, you don't have on a mask. That's the reality, is that all of our health professionals have told us that the point of wearing the mask in public is to cover your nose. And so if you are someplace and you have the mask beneath your nose, that is, in effect, not wearing a mask, because the virus spreads through the nose. To get our numbers back down and to flatten this curve, it will require all of us to make sure that we're doing our part together as a community to keep each other safe. You all have done such a beautiful job throughout this, and we know we're asking so much. But if we work together to make sure that we're doing everything that our health professionals are advising, I believe that we will once again be able to get this curve flattened and be able to get the numbers reduced. Now, today we begin to picture a future free of COVID-19, and we believe that that future is only possible because of thousands of scientists from all across the world who have risen to the challenge to develop a safe and effective vaccine that stops COVID-19. And with these vaccines, we now can see a time after all of this uncertainty where we can gather with our friends and family without worry and without masks. That's a future all of us want, but it cannot happen if we do not commit to protecting ourselves right now. Throughout the county, throughout this pandemic, you should know that your county government has worked hard, and we will continue to do so, to provide the needed services, food, and mass testing for COVID-19 to residents. Throughout these efforts, all of our emergency management personnel and health officials have learned a great deal about the pandemic. And so we're taking advantage of what we've learned as we gear up for mass distribution of vaccines. I want to thank Dr. Carter, Dr. Askew, and Director Gill, who already have a very sound vaccination plan in place that will allow us to effectively ramp up and deliver the vaccine to residents across the county once it's available. And as a part of that plan, we recognize that there may be some hesitancy as well regarding the vaccine. And to help address the concerns of our residents, we're going to hold telephone town halls. There will be one scheduled, for example, this upcoming week, as well as virtual forums to make sure that the entire community receives the information they need to understand how this vaccine works. We want every Prince Georgian to fully understand how the vaccine will protect us from COVID-19. We know that that will take lots of communication and education, and you should expect to hear and see that from us in the coming days. When we take this vaccine, it not only protects us, but what you should know is that it protects your spouses, family, friends, neighbors, and those we worship with, those we love so much. And just as we have been together in terms of everything that we have done to follow the guidelines of public health officials and protect our neighbors, we will certainly be proud to be protected from COVID-19 through this vaccine. And so moving forward, your county government is prepared to distribute the new vaccine to those who need it. The amount of vaccine that we will receive initially will not be enough to cover the entire population. Instead, we have limited quantities that will be distributed based on need as recommended by the Centers for Disease Control. And we will distribute them to our vulnerable populations and frontline healthcare workers who will be among the first to receive the vaccine. Now, Dr. Carter will talk more about the plan in a moment. But what we know is that production of the vaccination will increase over the next few months and be more widely available in the new year. And I want you all to know, I understand you are tired. I have heard it, I've seen it. I know that you are really fatigued, but we must continue to stay the course, making sure that we are doing everything that's advised. And what I can tell you for our part is that we will continue to be truthful and honest with you. When we know information, we will share it, and if we don't know, we will say so. But we will proceed with transparency and continue to provide you with the most up-to-date information as we have since the beginning of this pandemic. Now, while there is light at the end of the tunnel, we also understand a couple of things that I want to discuss with you. One is that COVID-19 has taken an enormous emotional and psychological toll in our community. And today I am proud to announce that we are doing something to address a couple of issues that have really been unearthed by COVID-19. One is that we already knew that there were huge behavioral medicine concerns in our county, and I'm proud to announce that we have received 2 grants from the Maryland Health Services Cost Review Commission that will help us address these and other issues. Again, I want to thank Dr. Carter, Dr. Belina Shaw, and our health department staff for helping us to obtain these grants, as well as Dave Chernoff and his team at TLC Maryland for also helping write these grants and for overseeing them on behalf of our regional partnership. I also want to thank all of our hospital system partners who will be involved in one or both of these grants, including Adventist Healthcare, Fort Washington Medical Center, Luminous Health Doctors Community Medical Center, MedStar Southern Maryland Hospital Center, MedStar St. Mary's Hospital, and the University of Maryland Capital Region Health. Now, over the course of the next 5 years, Prince George's County will receive $22.9 million for behavioral health. This is huge for us. This is the largest behavioral health grant awarded to any single county in the state by the Health Services Cost Review Commission. This funding will allow us to do a number of extraordinary things for our community. We'll enhance and expand mobile crisis teams for residents experiencing mental health issues, reducing response times. We will also create a crisis receiving and stabilization center where medically stable individuals can receive timely care coordinated by behavioral health professionals without having to go to the hospital. We will implement technological advancements to our crisis call center and mobile crisis team operation to improve electronic referral services. We will also expand a specialized technology enabled a case management system for high-risk, high-need individuals who are being discharged from the hospital. And we will expand transportation option for those with behavioral health needs who are involved in the crisis system. This is huge for us to make sure that we're caring for the mental health of our residents. And in November, our residents also approved a bond to build a mental health and addiction services facility in the county. These two separate projects will be highly complementary, and I'm so proud that we will have these additional resources as we work to build a singular behavioral health continuum in Prince George's County. In addition to these important advances, Prince George's County also received a grant for more than $7 million over 5 years for diabetes treatment and prevention. This is huge. We have talked about diabetes and many of the comorbidities, which we know really did impact how the coronavirus affected so many in our community, sickened us, caused many of us to die. And so the grant was awarded because of the successful implementation of the Prevention Link program through our county health department. This program allows the health department to work directly with healthcare providers to coordinate care and to ensure patients are completing diabetes prevention programs. And so this is going to be major for us. And what we know is that too often we have seen, of course, instances where Black, brown, impoverished, and disadvantaged communities pay the price for poor access to health care. Time and time again, studies show that minority communities lack equal access to care. And then when minorities seek treatment, there are often disparities in how that care is delivered. And so we can see clearly how this has played a role here, and we are taking action to really correct this disparity and to save the lives of countless Prince Georgians. These grants will help offset the long-term harm caused by disparate access to health care, and they will also help ensure that in our recovery from this virus, we can improve the health and well-being of all of our residents so we never, ever find ourselves in this same position again. We're still on this journey with the COVID-19 crisis, but thank goodness that we are also now entering another phase with the vaccine, and that means that we're coming closer every day to being able to put this pandemic behind us. As we look ahead, we will do everything we can to maintain an open dialogue with all Prince Georgians, but these vaccines represent hope for thousands of vulnerable residents, for their friends, and for their loved ones, and we promise to do everything we can to make sure we deliver this vaccine to Prince Georgians safely and as soon as possible. For the foreseeable future, hear me once again, we must, hear me, continue, please, to wear your mask, avoid gatherings with those outside your immediate household, and maintain physical distancing to limit the spread of this virus. However, we see the end at the light of the tunnel, and we must all continue to do everything we can to ensure we make it there safely and healthy. Now I would like to hand over to Dr. Carter for his COVID-19 update and to provide background on how the vaccines work and to protect us from illness. Thank you.
Thank you, Madam County Exec. Thank you, Gina. Good morning, everyone. I would like to thank Prince Georgians for their partnership in these challenging times. It's an honor to serve as your health officer and to help guide you through these challenging times. First, I'm going to talk a little bit about the data. Prince George's County recorded more than 2,900 new COVID-19 cases last week. That's the highest weekly total in the county since the beginning of the pandemic. The county also has now recorded the highest daily COVID case rate of this pandemic. An average of 46 people in Prince George's County per 100,000 population get the virus each day. That's over 400 people a day, and the last count is over 500. That means the virus is spreading at a very rapid rate. Our hospitalizations have also spiked. In the past month, the number of inpatients with COVID has more than doubled in our county hospitals. On November the 8th, there were 68 people hospitalized with COVID. On December the 8th, there was 177, and that's increasing. While the number of people hospitalized with COVID has gone up, the number has not yet reached what we were seeing back in May, and there's a reason for that. Lately, our new cases are trending younger. More people under the age of 50 are testing positive. This is an age group that has a lower hospitalization than those folks older than 50. At last check, about half of the county's overall hospital beds, including surge beds, are occupied. And patients with COVID-19 occupy 54% of our ICU bed capacity. We're monitoring this closely, especially as the holiday season continues and the winter arrives. The county's positivity rate has increased above 10%. This means that 1 out of every 10 COVID tests conducted comes back positive. Our positivity has not been this high since early June. The infection rate remains stubborn. This is the rate at which a COVID-positive person passes the virus on to someone else. The county's infection rate is 1.1, and that's high. We have been over 1 for the past 2 months. So it's clear now that COVID-19 continues to spread and make our residents sick. And that's why the safety measures the county executive talked about must continue, and we need your help. Wearing a mask over your nose and mouth when you're in public will help protect you and others from the virus. Staying at least 6 feet away from people in public will help protect you and other people from the virus. Contact tracing data that we get show that gatherings and parties with people who you do not live with is really causing the spread to increase. Make smart choices. For example, when you do your holiday shopping, do it online. They'll deliver it. Do it online. Stay safe and stay at home as much as you can. The more we reduce our chances of infection and spread, the quicker we can move away from this virus. Now, as the county executive mentioned, the FDA is on the verge of approving 1 or more COVID vaccines. Prince George's County and its health systems are expected to get our first batches before the end of the year. This is an important moment in the pandemic on many, many levels. It's important that we prepare the county to receive, store, and administer the doses, but it's even more important that we educate the county, not just about the COVID vaccine, but about vaccines in general. Vaccines help our body fight off infectious diseases. What they do is they help our cells and our immune system to recognize a virus when it gets into our body, and then our body takes that information to develop these antibodies, which are molecules that act as weapons to not only remember what the virus looks like, but also to fight it and to kill it. That means if you are then exposed to the virus in the future and you've been vaccinated, your immune system then can quickly recognize and destroy it before you get sick. And your body can do this over a long period of time. They'll fade away. You might need to get another vaccine another time. And if you all know about vaccines, that's the way vaccines work. As a pediatrician, I've been doing this for 40 years. And as the health officer in this county, I know that this will work. Now, if the FDA concludes a COVID vaccine is safe and effective in early clinical trials and approves it for emergency authorization, and we, myself and my colleagues, scan that information and come to the conclusion that it's safe and effective, then I'm going to take the vaccine publicly, and I'm going to say very clearly that this vaccine is safe and effective. The FDA review of a virus research is very extensive and is very rigorous, and they put in a lot of safeguards, and they make sure they continue to watch for like allergic reactions and other things. That's our job, that's their job. But in these tests that they put these vaccinations through are not easy. It's very hard to get a vaccine through and approved. So people have been looking at and scrutinizing this for a while now. Both these vaccines that have currently emerged, both Pfizer and Moderna, report their vaccines are 95% effective against COVID-19. That's a very strong and high rate. Most viral vaccines are not nearly that effective. That gives professionals like me a lot of confidence that this is going to work against COVID-19. Many are wondering how COVID-19 came to fruition so quickly. Now, keep in mind, scientists had a head start on this. COVID-19 is part of the coronavirus family. Research on that family has been has been continuing for many years now. So when this new virus came, which is part of the family, and arrived in late 2019, that's why they call it COVID-19, scientists were ready to piece that puzzle together. So governments poured a lot of money into making sure that this vaccine was researched and developed well. And that just doesn't happen all the time, not that much money. Governments don't pour as much money as was poured into this research and ultimately into the clinical trials. And what the money does, it helps accelerate the research process, and it helps us to get to results quicker. We know everybody will have a different comfort level about the vaccine. Our goal is to make you feel better about it. So we're going to talk about it. This is just the beginning of our conversation with you and the beginning of the process. If the FDA approves the Pfizer or the Moderna vaccines, this first batch will be limited. It'll be a limited number of shots. We don't know for sure how many doses will initially come to Prince George's County, but we'll keep you updated on that. The health department will make sure that the vaccine is distributed and administered in a safe and phased approach. Among the first to be vaccinated will be our frontline healthcare and hospital workers. We must maintain their strength and their resiliency during this pandemic. There has to be enough staff to care for folks who get sick. So we got to vaccinate those people. Residents and staff of nursing homes and long-term care facilities are also in that first group. Nursing home residents have the highest risk for severe illness and death from COVID-19, so we've got to get to them early. Other groups expected to be vaccinated in the first phase include certain first responders, essential services workers, and our vulnerable populations, who, if exposed, are likely to get sick and could possibly die. These categories are still broadly defined. We will update you as soon as we have developed more about the specifics. I do know this: it'll be months before there's enough vaccine available for the general public. So in the meantime, that's why it's so important that we all stay strong. We got to fight through this fatigue. We got to forge ahead and do the right thing. And we know we've told you that a million times. And you've got to keep your family healthy in 2021. Thank you very much.
So next we'll hear from Ronnie Gill, who's going to speak about the vaccination strategy.
Good morning, Madam Exec. Vaccination distribution and administration will be managed by utilizing the Incident Command System. This is used by most public safety and health entities to manage major events. The incident management team is comprised of personnel from both the Health Department and the Office of Emergency Management, as well as support personnel from county agencies and our external partners. The team is structured into 4 sections: operations, planning, logistics, finance/administration. The overall vaccination distribution and administration process will be managed through collaborative efforts by the health officer, Dr. Carter, and myself. And the day-to-day operations will be managed by all of our personnel. It is important that we operate under a standard incident management system to ensure the success of this operation. The incident management team is using CDC and local health department guidelines to plan vaccination distribution and administration based on 3-phase approach. Planning includes expanding and contracting our current testing capabilities based on a number of residents that need to be vaccinated. COVID-19 testing efforts will continue throughout the vaccination distribution and administration. Logistically, we are planning day-to-day storage and allocation of the vaccine, including obtaining the necessary resources required to maintain the vaccination once this is received from our manufacturers. We have purchased 6 ultra-cold freezers and 8 standard freezers for vaccination storage. We have also procured through a contractor for dries as a backup to this storage operation. Each vaccination site will have additional staffing. This includes clinical and non-clinical staff to support not only the permanent sites, but our mobile testing units. We have purchased enough PPE to manage both COVID-19 testing, vaccination operations, as well as to ensure the continuity of county government services. It is imperative for us to have real-time data throughout this process. WebEOC will allow us to maintain situational awareness of the vaccination sites. This will include the number of vaccinations provided daily, logistical and resource issues that may arise, site performance metrics, and miscellaneous status information. The Health Department and the Office of Emergency Management continue to work closely with the Office of Information Technology to review other tools that can assist with the vaccination planning and distribution. All vaccination sites will operate by appointment only. We will initially utilize the Wayne K. Curry Sports and Learning Complex for the first round of vaccination administration. Additionally, the Health Department will utilize 4 clinic locations to provide vaccination administration. These sites include Largo, Laurel, Cheverly, and our Clinton sites. We will continue to partner with others to assist with the vaccination. This includes working with Kaiser Permanente. We will also be operating up to 3 mobile units throughout the various locations within the county. Drive-through COVID testing will be available at the Health Department facilities in Largo and Clinton. Appointments are not required. The COVID testing will be also available at the Health Department facilities in Cheverly and Laurel, and this will be by appointment only. The county has made tremendous investments in the planning and preparation of distribution and administering of the vaccine. We're confident that we will be well equipped and ready to implement and effectively manage our vaccination plan. Lastly, as Dr. Carter stated, this will be a number of months, 6, 7 months. We ask that for your patience as we navigate through this phase of the pandemic. This will be an ongoing process that will take time. We must ensure that it is done correctly and for the best interests of our residents. Thank you.
And next, we'll hear from Dr. Askew, who is going to speak about vaccine hesitation.
Good morning, everyone. Like Dr. Carter, I have been doing medical and public health work for decades. I am also a middle-aged black man who has grown up in this country. I was born and raised in inner-city Cleveland. And as an aside, of course, that means I'm a long-suffering Browns fan. But seriously, believe me when I tell you, I understand the questions, concerns, and misgivings many of you have regarding receiving the COVID vaccine. Let me share something with you. In this picture, you see me in the middle, in the fashionable knee pants. To my left is my father, George Andrew Askew, Jr. To my right is my grandfather, George Andrew Askew Sr. And in the middle, behind me, and flanked by his son and grandson, is the Reverend Noah Askew. The Reverend Noah Askew is the son of a former North Carolina slave, also named Noah Askew. The voices of these men from slavery to today ring in my ears. Their stories of, and my witness to, their struggle, oppression, denied access, and marginalization, and my own, are part of who I am and what I believe. And I can tell you, not once in my lifetime did any of these men say to me, hey, trust in your government. Trust in your government. It will always do what's in your best interest. Nor did they ever say, never question what the man is asking you to take, eat, or inject. I know many of you have similar histories and experiences, both native to this country and county, and those of you who are relatively newly arrived. What I will assure you as a public health and government official here in Prince George's County is that we will always work our hardest to promote, enhance, and preserve the health and well-being of all Prince Georgians. I know what you could be thinking when I say that. So please, understand this. When we roll out our vaccine delivery here, we will do so with the confidence that it is in the best interest of the health and well-being of the county, and we wouldn't do it unless we truly believe that to be so. Therefore, I am urging you, when the vaccine becomes available to you, join us in taking the vaccine and being proud to be protected. Thank you.
And with that, thank you, Dr. Askew. We will take any questions. Tracy.
nursing homes gets it, and so can you explain, like, based on the timeline that you all have now, when you think you're gonna get it, when are we talking about people going to these places to get vaccines by appointment or not?
Are we talking about the general population?
Yeah, so when should folks expect it? Should it be like the first rollout for frontline workers happens for the first week or two, and then the general public, what would that look like?
As far as I know, Dr. Carter, we haven't received that information from the state of yet. I'll let Dr. Carter further explain.
Thank you. Well, what's going to happen with the vaccine distribution is that there are several phases that we'll go through in terms of making sure that our first frontline workers at the hospital system get them, and then our nursing homes. That's that first phase. And that's going to be over a few weeks. That'll take a few weeks. And then the next phase will come where we go to the next level of people at risk, which is people who, of course, our vaccinators will be in that, but it'll be other people at risk, like our firefighters, our policemen, people who have to come within 6 feet of somebody. That's when we're going to vaccinate who have to. So we're going to vaccinate all of those folks. And how, when, and where, we're still working through. And then lastly, in that same first phase, we're going to vaccinate the people at high risk. And it turns out in Prince George's County, it's a lot of folks. So that's going to happen. You're going to see a gradual ramp up, and then you're going to see this huge surge. It's going to take a few months before we get to that huge surge, and then the general public. So we're still in conversation with the state about that, still in conversation with the federal government. But as we find out, you all will be the first to know, okay?
So frontline workers, people who are in nursing homes,
Hospital, first it goes to the hospital workers. Those are the people in the ICUs and in med-surg and in emergency rooms, hospital workers, nursing homes. Then everybody else who's a frontline worker, which includes vaccinators, people who, as I said, people who are like police, firemen, people who have to come within 6 feet of somebody.
okay, and so you're looking at 2 or 3 months of dealing with this first phase before the general public gets it. Whenever it's distributed, we should be expecting like 3 months.
Right, you'll start to see it really increase in about 3 months. Hopefully we can get it done quicker. The quicker we get it done, the better off we are. The quicker we get it done.
There is a plan for distribution after the 3 months, but the 3-month part, you don't know exactly how you're going to be getting the vaccinations to the workers and to.
Well, we know how we're going to get it. We don't know when the vaccine will come. The minute we get vaccine, we're putting it in people's arms who will take it. So
What will that phase look like? The first phase, how will the distribution of the vaccine look in the first phase?
in the first phase, it's going to go to the hospital systems, and they are going to give people shots. It's going to go, we're going to vaccinate the nursing homes, which there's a program with the pharmacies that are going to help with making sure that happens. And then it'll come to the health department, and we're going to make sure our first responders and those folks who come within 6 feet get vaccinated, and our partners. And they're all signing up to do that for us. So that's how that's going to work. We're ready to go with that.
You mentioned about the confidence, and Dr. Ashley did as well in the vaccination. And you mentioned about you would take it publicly when it's approved and available.
Right.
Express a little bit more, sir, about the confidence level you have, especially being a healthcare professional, which a few folks who are still on the edge and not trusting.
Well, you know, when they first announced that the Pfizer vaccine and then Moderna were 95% effective, that came out in a press release. That didn't come out into an article that I can read and look at the research, et cetera. That's what they're doing now. When that process is done by the FDA folks and people who, frankly, Dr. Askew and I both know who are at that level, and they give us the thumbs up, then we're also going to read that because it's public. And then we're going to say, we're going to move on this. How confident am I about that? I'm 98%. That 2% is me reading it.
Just one quick clarification in regards, are gyms also included in the 25% capacity? Yes, they are. Just want to make sure.
Tracy? I'm sorry, go ahead, Justin.
Yeah, it's kind of a follow-up, Dr. Carter. From what I understand and kind of what you were alluding to with the distribution process, when it goes to those hospital workers first, it's the hospitals that take care of that. The nursing homes, they take care of that with their own clinics that they have there. And the first round with the actual county will be at the Wayne K. Cray Center, correct? And that's when the first responders will be there?
That's that plus our partners. We're partnering also with Kaiser and with other partners. Our providers in the county are signing up as we speak to help us. So we're reaching out to urgent care, all of our partners. This is an all hands on deck. We've got a lot of people to vaccinate. But right now, the health department is taking that lead and making sure that when that vaccine comes, we can give it to those folks.
And so then when you mentioned Largo, Laurel, Cheverly, and Clinton, are those locations going to be part of that initial first round, or that comes after the Wayne K. Cray?
It will be a gradual build-up, but you'll see all that happening in the first 2 to 3 months. You'll see those places come up. We'll be ready for the first doses that we get at multiple specific locations, and then it'll gradually increase as you'll see.
Tracy, did you have something?
We've been hearing, I didn't see what was the response to the question about the gyms being hurt 25%? Are that?
Yes, they are.
They are, okay. And my second question was about, we've been hearing reports of some people who've been calling their medical doctors and trying to make appointments in advance to get the vaccination and then saying, I'm a frontline worker, I want to be at the front of the list.
Dr. Carter, can you answer that?
And how that process will work with private doctors versus what you all have set up?
I have to tell you, I don't know what's happening with the private doctors responding in the manner that you just said. So I think I know there's a training. If you're a doctor who's going to administer a vaccine, there is a training that they have to go through. And I think perhaps those private doctors that you're mentioning maybe haven't gone through that training. But if they go through the training, they have to sign up into Immunet and in the state's information systems, Immunet and PrepMod, and they have to have a training. They have to know how to handle the vaccine because it's in ultra cold storage. So when they get it, they need to know how to handle it, and they need to know who's going to get the vaccine when. I don't think the doctors that you mentioned have gone through that training.
Okay, so residents should be expecting to get vaccinations from the county and not from private doctors and from hospitals.
Those private doctors who have gone through the training and who are registered they will get vaccine and they can give vaccine. And they should expect that they can get it from their doctors. Their doctors should make them, but they have to do it through appointment because that's how we keep track of it. The appointments go through that PrepMod system and we keep track of it. That's how we know who's getting what, and that's how we know whether or not you are a first responder or whether you weren't, and whether you were high risk. So we have an information system that's tracking that. The doctors know that when they get trained. That's what has to happen.
So can you talk about insured versus non-insured? Is any of that going to play a part in who's getting vaccinated?
Not at all. This vaccination is free. Now, just like with the test, we can charge insurance companies for this because the insurance companies are paid from the federal government to cover the cost. But anybody who doesn't have insurance will get vaccinated. We're vaccinating everybody. We've got to vaccinate. If we could vaccinate 85% of our population, that would be ideal. But minimally, we've got to vaccinate 65% of our population. And you can imagine we've got 909,000 folks here. So you know how many people that is. So absolutely free. The government is supplying this free. And I don't want anybody to think that it isn't.
Well, you know what? If Dr. Carter takes the vaccine, I'm taking the vaccine. So, and if Dr. Askew takes the vaccine, so in other words, when the health and medical professionals say that this is safe to take, then I'll accept that advice and I will happily take the vaccine as well. In fact, I'm looking forward to it. And so as soon as Dr. Carter says it's go and that my category of person is eligible to take it, I will take it.
And this is a long-term process, right? There's also 2 shots that folks will have to get. And maybe it's the health professionals to address the fact that folks should still be wearing masks even if they've gotten that first shot as well. Can you talk about that?
Yeah, thank you. That's it. Yes, you have to wear a mask. You're going to have to wear a mask throughout this whole process because to get to the point where the virus won't spread, like I said, you've got to immunize a lot of people. In the meantime, the virus doesn't care about any of this, so it's going to spread, so you have to wear the mask. And if we're vigilant about that for this period of time, and we're going to try to do it in 6 months. Hopefully, we do it quicker or maybe take a little longer. We can get to the fall or the end of the summer where we are at a different state. But you're going to have to wear the mask, and you've got to maintain the 6-foot distancing and clean the surfaces.
Has there been a decision made about residents versus people who work here or who's getting the vaccination in Prince George's County?
I couldn't hear you.
Has there been a decision made about people who work in Prince George's County versus those who live in Prince George's County getting vaccinated here?
Our decision is to vaccinate all of the folks who live in Prince George's County, but if they happen to work in the hospital and they're from somewhere else, the hospital will make the decision about vaccinating them more, and they will vaccinate them. And there hasn't been a decision made, but I'm a very strong advocate. If I have my vaccine in hand and I've got a person here, I'm going to vaccinate them because I need the people all over this region vaccinated, not just Prince George's County. But we are going to be sure that we have enough vaccination to vaccinate our residents. So we work with we work with our surrounding counties and our surrounding places. And there's a lot of conversation around that very point. But we're going to be sure that folks get vaccinated.
Okay, and so I just want to say briefly, as the county executive mentioned, we are launching a campaign. It's Proud to be Protected. So I will just say that you will see a lot of information come out over the next couple of weeks through social media and other platforms. We certainly want to make sure that the community is engaged, that everybody's questions are answered. And as the county executive mentioned, we'll be having a tele-town hall. That information will be put out probably by the end of this week. But everybody, thanks so much for coming.